So this is the respiratory system model. So this structure here is the tongue. This is the mandible. These would be lips. And this is the oral cavity here. This is the nasal cavity. These are the nasal concha. Okay, this is the inferior, middle, and superior nasal concha. Once I get to here at number 2, this is the beginning of the pharynx. The pharynx is the word for throat. Now the pharynx has 3 regions though, so this portion of the pharynx is called the nasopharynx. The nasopharynx. The portion of the pharynx that lies posterior to the oral cavity is the oropharynx. The oropharynx. This portion here and here, all of this before we get to the trachea, this is called the larynx. The larynx. So for that reason, the portion of the pharynx here is called the laryngopharynx. The laryngopharynx. When you swallow, this structure here, called the epiglottis, is going to fold down and block off the airways. Okay, so that food is directed down into the esophagus here. This entire airway here is called the larynx. Here is where we have the vocal folds and the vocal cords are all here. And the area just around the vocal cords is often referred to as the glottis. It's called the glottis. I have some cartilage that is around the larynx. In front here, I've got the thyroid cartilage. Below the thyroid cartilage and here posteriorly, both of these are called cricoid cartilage. So air is going to move down the larynx and get into the trachea. So once I start to see these rings, at this point I'm at the trachea. Each of these rings are called the cartilaginous rings of the trachea. The cartilaginous rings of the trachea. Now the trachea is going to bifurcate or split into the right and left primary bronchi. Bronchi would be plural, bronchus is singular. Now, both of these are going to branch, but we have only the view of the right lung being opened. I do wanted to remind you that the right lung has 3 lobes. It's got the superior, middle, and inferior lobes, and the left lung's only going to have the superior lobe and inferior lobe. Here's the trachea. Trachea is going to branch off into the left primary bronchus and right primary bronchus. From the right primary bronchus, you can then see another split, and this gives rise to the secondary bronchi. The secondary bronchi. All right, the secondary bronchi are then going to split again to the tertiary bronchi and so on. So I'm going to continue to get more and more splits until I get down to the very fine airways, which we call the bronchioles. The bronchioles. The bronchioles continue to get smaller and smaller until we get to the smallest type of bronchiole, which is shown here. So this would be a terminal bronchiole. A terminal bronchiole. Terminal bronchioles are going to end in an alveolar duct, which we see one open up here. Okay, an alveolar duct, and the alveolar ducts are going to end at alveolar sacs. And alveolar sacs are where we are going to have exchange of gases between the blood and the respiratory system. In this, each one of these is a single alveolus or pulmonary alveolus. Even though they're only showing the capillary beds here, just know the capillary beds are on top of each of the pulmonary alveoli. These capillary beds are what is going to allow exchange of gases between the circulatory and respiratory systems.